All right, good evening, everyone. Let's kick this evening off. Before I introduce our speaker this evening, I would like to give a brief background of this evening's presentation. So, as we know, more than 100,000 people in the US died from drug-involved overdose in 2022, including from illicit or prescription drugs. Opioid-involved overdose deaths rose from 49,860 in 2019 to 81,806 in 2022. The number of opioid-related deaths has been rising continuously since 1999. Three different waves of increases are related to different types of opioids throughout the last 25 years, and over 75% of the nearly 107,000 drug overdose deaths in 2022 involved an opioid. Collaboration is essential for success in preventing opioid overdose deaths. Medical personnel, emergency departments, first responders, public safety officials, mental health and substance use treatment providers, community-based organizations, public health, and members of our community all bring awareness, resources, and expertise to address this complex and fast-moving epidemic. And our purpose this evening is to bring awareness, increasing community support, capacity, and education may help turn the tide and prevent overdose deaths. Together, we can better coordinate efforts to prevent opioid overdoses and deaths. This evening, we have a wonderful speaker, Tanvi Narava, who is a senior at Piscataway High School that has been working on her Girl Scout Gold Award Service project all about overdose awareness. She aspires to teach the youth on how to administer Narcan and overall decrease overdose death rates in New Jersey. So let's hear from Tanvi, and in the end, we will have some time to take questions and questions from the audience. I would like to also recognize Indo-American Cultural Foundation of Central Jersey, ISCFNJ, Indus TV, Rotary Club of Plainsboro, South and North Brunswick, Glow India, MHO Hotels, and Gopio Central Jersey for becoming a partner with Health Camp of New Jersey this evening to provide this educational presentation to save lives. Welcome, Tanvi.
Hi, thank you so much, Dr. Patel, for that introduction. Like mentioned, my name is Tanvi Narava. I'm a senior at Piscataway High School, and my project, Renew You, Embrace You, is all about overdose intervention and awareness. Like mentioned, I aim to educate the youth and also young adults on how to administer Narcan, what is Narcan, how can we counteract overdose, what even is an overdose. So I guess that's the essential point of my presentation. So, Dr. Patel, if you could pull up the presentation whenever you're ready.
Yes. All right, all yours.
Perfect, thank you. So like I mentioned, my project is all about overdose intervention. Um, if you could go on to the next slide really quick, please. So what will we be learning about today? So first, we're going to touch on what is an overdose, the signs of an overdose, how to intervene in an overdose emergency, and healthy alternatives. So this is a little bit about my project itself. So Renew You, Embrace You is my Girl Scout Gold Award project, which, if you don't know what a Gold Award project is, essentially an 80-hour commitment to a service project in the community. So I've done my Silver Award and my Bronze Award, which are both very esteemed projects and awards in Girl Scouts. I've been a Girl Scout for over 10 years, since first grade. I'm now a senior in high school. So I've stuck with it and for a while, and I've learned a lot through it. Specifically why I chose Overdose. I am aspiring to go into healthcare, specifically medicine, and I really want to do something that's healthcare related where a lot of these topics, a lot of the more overlooked diseases, healthcare issues, were more touched on. overdose was something I feel like a lot of people don't think about, and there's a lot of stigma around, especially as a youth, a young adult, a teenager, going to school, being with teenagers. I recognize how prevalent over substances and drugs are in the modern day. So I really want to educate my peers and young adults on what it is and how it can have a consequence or how it can affect your body, excuse me. So like I said, the goal of the project is to spread awareness and also how to intervene, because I think that a lot of people don't know what to do in an overdose. Oftentimes we don't even think that an overdose would happen. So just bringing in Narcan and talking about it. Essentially how the project came to be is I talked to a lot of rescue squad members in local Middlesex County. I'm from Piscataway, so my county's Middlesex. So I talked to some people from South Plainfield Rescue Squad, and they had mentioned that they've had a lot of cases and emergency where overdose was very common, and they wished more people knew about Narcan. So, so what is an overdose? An overdose, we can go to the next slide really quick. Yes. So an overdose is an intake of a drug or medicine that is way too high and that your body essentially rejects whatever you're putting in. I think, like I mentioned earlier, there's a lot of stigma around overdose. When we think overdose, we think the classic drug addicts. We think people on the streets, people that are, taking the wrong route in life. That's not what an overdose, that may not look like all the time. An overdose could be an intake of just medication. You can be taking your average medication and your body may be rejecting it. Maybe you got too much. It's always too much of your system that your body can't handle. It could be prescriptive, it could be legal, it could be illegal, it could be absolutely anything. It could be drug and opioid, something stronger, pain medication. But an overdose can happen due to absolutely anything. And I think that's one of the biggest things I want to hit on, that it's not the average, oh, drugs for the high, the feeling. No, it could be just, you have a broken knee or a broken leg and you are taking prescriptions from your doctor and you accidentally read the bottle wrong and you take too much. So an overdose can look like in several different ways. So 96,700 people die from drug overdoses per year, which I think that's the stat is a lot. It's a lot to take in. A lot of people don't recognize, especially now with the epidemic, the fentanyl epidemic. It's becoming way more prevalent. It's often overlooked, like I mentioned earlier, but it is something very common in modern day. And I think it's very, very important to consider that these people are losing lives daily, especially from something that is so preventable. For example, here are some common opioids that I have on the side: fentanyl, codeine, methadone, morphine, oxycodone. Some of these may sound familiar to you, some of them may not, but they are very common. And also, opioids could be prescribed from your doctor just for pain medication, as they are stronger. So it can happen absolutely anywhere. So we have like a little video. If you can just click the link, it should take you right then, and I'll tell you when to stop. There's a starting point at 51 minutes. Dr. Patel, I don't think we can hear it.
Not every overdose needs to end in death. These two industrious young gentlemen have stolen opioid medication for recreational use. Oxycodone, hydrocodone, fentanyl, and heroin are a group of chemicals referred to as opioids. The first three may be prescribed by a medical professional to treat pain, but they can be addictive and deadly, especially if not taken as directed. Heroin has no legitimate medical purpose. Opioid overdose is the current leading cause of death for people under 55. True or false? More than half of Americans have been affected by opioids. Correct. Over 70,000 people died of opioid overdose in the United States in 2017. And millions more were impacted through overdose or misuse. That means that if you have not been directly affected by opioids, someone you know likely has.
Okay, this is a good spot to
But
start.
not every overdose needs to end in death. Today we're going to teach you to spot the signs of an overdose and administer naloxone.
Is that good?
Yep. Yep.
A life-saving medication.
So the point of the video was to just share some more statistics with you all. That is from Walmart themselves. So this video got a lot of views. It was really important at the time. So I just want to share how nationwide and how influential overdose has been. Okay, so now we're going to talk about how opioids are misused. So I did mention this a little bit earlier, how it can happen in any form. Here's some specific examples. So not following instructions from your doctor. These opioids can be highly addictive. So oftentimes people, if it's a physical issue, they're feeling a lot of pain, they will kind of start getting addicted to it. Obviously, that is not something that should happen. And obviously, your doctor's prescribing you with the right dosage, the right instructions for you to follow. So it's very, very, very important that you have that conversation with your doctor and your healthcare provider to make sure that that's clear and understood on both parties. If that is a problem for you and you think that there is a chance of you getting addicted, or if you have any concerns, obviously you want to communicate with your healthcare provider. So yeah, like I mentioned, taking pills that are not prescribed to you. Again, you never know how your body may react to something new. Taking something that's not prescribed or not recommended from your doctor should not be happening because your body could reject it and you could essentially overdose. Taking opioids to get high, the feeling, addictiveness, all of those you want to avoid. So having clear communication with your doctor and your family, making sure you know what's going into your body. You want to make sure you're very well aware. And also medicine misuse, like I mentioned earlier, like getting an ankle sprain, breaking your knee or anything, that could also, lead into an overdose if you don't read the bottle correctly and you take too much. So there are very clear signs of an overdose. These are the generic things that, will come up if you have the suspicion that someone is overdosing. For example, the person may not be responding. Just for some context, overdoses happen very, very rapidly. Essentially it goes into your bloodstream and you kind of just knock out. If you don't have Narcan on you, that person could potentially die. Because it's a lot for your system and a lot for your blood. It's going right through. It's happening so rapidly. So acting quickly and knowing how to use Narcan is such a beneficial skill, which has been my biggest motive and incentive of the presentation. The project itself is to educate people on how to use Narcan, which we'll get there in a second. So the signs of an overdose is obviously not responding. You may not be breathing. Their breathing may just be different paces. It might be slow. They may be like gurgling or making sounds, not the average, you'll see a reaction both physically. So your lips or your nails may be different. The color might be different. Their skin might be like different and cold, different temperatures, and your pupils may look dilated, very tiny as well. So this is the main part, how to intervene. So we're going to talk about Narcan and naloxone, which is the alternate name. They're interchangeable. Narcan is essentially a reverse opioid. I think I should talk a little bit more about it on the next slide as well. But Narcan, like I was mentioning, it is a reverse opioid. You can purchase it at any pharmacy. Uh, Nowadays, there is a campaign which I've been trying to spread more awareness and get pharmacies. I've been calling pharmacies to get involved with. It's called Be a Hero campaign. And actually, if the pharmacy engages with that campaign, you can get free Narcan, just with like mentioning that campaign at the front desk or whatever, the pharmacy. And they should be able to give you Narcan for free. There's many ways to get Narcan. For example, Rutgers, they do Narcan distributions very actively, the Rutgers Health Service Corps. There's a lot of centers for Narcan as well. But essentially I have it on me, so I'll show you. It looks essentially like a nasal spray. It quite literally says nasal spray too. It can come, the medication's in here. Pretty much you would just take it out, push the bottom, and it's like an inhaler. It'll go right up through the person's nose. The very good thing about Narcan, which I think a lot of people don't know, is that it can't hurt you if you aren't overdosing. So even if you see someone on the road, or if you're having a situation where there may be an overdose, but you don't have the confirmation or you're not sure if it's an overdose, using this will not hurt the person. In fact, it may bring them back to life. That's the whole point. It's life-saving. It can come in two different forms. It can come in a nasal spray and an injection. The most common is this version, the nasal spray. This is the box I've had, but you can get it from any pharmacy. This is the one that I got. You can get it essentially anywhere. So it's a nasal spray. You just put it up their nose and it'll go right in, and it should go directly down to their body, and it should revive them. So that's essentially Narcan. So in Middlesex County, there was about 1,000 Narcan administrations in 2022, which caught me off guard because, especially in the county that I live, Middlesex, I did not know that it was as common as it was. It is actually. I didn't realize that it's actually happening all around me, and I think that definitely put things more in perspective of what's happening and how valuable this information is. 1,000 Narcan administrations is a lot, especially for a county where, again, I didn't expect it, and a lot of drug overdoses is not very known here. So I was very surprised. And again, this is just Middlesex County. I know nowadays the state itself has so many more cases. The government is trying to pass laws about it. Like, there's a lot going on. So I think this is really important to just be aware of. So essentially, if you were in an overdose emergency, you would take your Narcan, which I would highly suggest having on you. It's kind of like a life skill, kind of like CPR. A lot of you can get Narcan trained as well. It is very valuable because it is life-saving, and it's really, really easy to use. You just put it up the person's nose, you use it as an inhaler. So let's say you were at a party, or if you were with kids and you were underage drinking, you were doing drugs, whatever you may be doing. I know the biggest concern as a student, as a teenager, whatever, is, oh, like, am I going to get in trouble? Or what are the cops going to do if they show up? There is something called the Good Samaritan law, which actually protects you. So the whole point of that law is, even if you are doing something you're not supposed to, you never, ever, ever want to leave your friend out there alone. You want to call 911, use your Narcan if you have it, and act immediately, because that, like I said, it happens so fast. The person could be losing their life just in your moment of panic. So the easiest and most, the best thing is to really just act quickly. Know that, yes, you might get in trouble with your parents, but you'd be saving a life. So, don't flee the situation. You never want to flee. You don't want to leave your friend or whoever you're with just out there to, be in pain by themselves. That's not the case. You always want to call 911. That should be your first step. Even if you don't have Narcan, be with the person, call 911, try and find someone that has Narcan possibly on them, or naloxone. If you're driving, I would just go to the hospital, or anywhere you could, maybe even a pharmacy, wherever the case may be, get Narcan as soon as possible and ask for help. So here's are just like healthy alternatives. As a teenager myself, I recognize that substances, alcohol, all these things are very common nowadays. So just be mindful of what it is you're putting into your body. Know that your surroundings have a huge impact on you. You know, you want to be very mindful about the people you hang out with and be very aware. I think a lot of people don't recognize the consequences or the extent of the impact overdose or drugs, you know, can have on your body. It is life changing, quite literally. You know, you never know how the trajectory of your life may look after. So it's very important to just stay safe, do what's best for you, and know and just be very, very aware and spread awareness, you know, tell other people, know what it is that you're ingesting and what anything else may happen, the outcomes of the situation. So here are some just alternate resources. There are links to stats and then, you know, some more resources that you may be able to get. If you have any more questions, if you want anything else, I have a list. I can provide you with that as well. So yeah. Here's something else I did this summer, which was very exciting. I hosted the first annual overdose flag ceremony on August 31st, which is International Overdose Awareness Day. So all the purple flags and the white flags represent the deaths and the people that have been affected by overdose in my community in Piscataway. It was a really, really rewarding event. I partnered with Wellspring Prevention, which is actually funded by the state. They're like a little nonprofit and they work towards spreading awareness about substance use, drugs, and all of tobacco. They work against harm reduction. So all of that, and it was really, really rewarding. We had people come from Robert Wood Johnson, the hospital, the Recovery and Addiction Center. We had the mayor come and talk. And overall, I would say it was the highlight of my summer just because I know that I was able to do something meaningful and leave an impact in some way. So those flags were up. We just kind of had a little ceremony and remember those who've passed. So that was like one of the highlights of my project so far. In addition, I've been able to give presentations at my school, the same presentation. I've done things with Girl Scout troops and just spread awareness. I'm working on doing more. My whole goal is to just spread as much awareness as I can and educate people on overdose and how to use Narcan. So I've been working towards that. Here's my Instagram, my account Instagram, Renew You, Embrace You. So on there, I just post a lot of information about overdose. Narcan, if you can see, there's like the Be a Hero campaign, just some things for you to keep in mind. And if you're interested in knowing more, it's up there in case you were interested in checking it out. So this is my contact information. If you have any questions, Miss Sharonda is the woman that I work from the coalition, also known like the Wellspring Prevention Center. So she's been helping me do the entire project and advising me. She's been a great resource. I have a lot of resources in terms of if parents or anyone wants any brochures, you can always send that over. Just about vaping, tobacco, drugs, you know, the basic stuff. I have a lot of information on that. So please let me know if there's anything you may want. And if you have any questions, I'm always here. So thank you. Thank you for listening.
So anyone has any question? I have Dr. Rajiv Mehta from Robert Wood Johnson joined. I have Niti Gupte, she's a PA. So if one of you has any question you want to ask.
Well, Tanvi, you did good. Any idea as to, because in India, having visited or actually returned recently, I saw that smoking and alcohol and drugs, really have taken off. And, there's so many more people that are binge drinking. And it's considered fashionable to be smoking, 20, 30, 40 cigarettes a day. And and drugs are readily available. So what is your impression about the state of affairs amongst the Indian community in the United States?
Yeah, like you mentioned, I do think it's very relevant in terms of just modern day. As a teenager myself, I mean, I go to school and I know that people are vaping in the bathrooms, a lot of people do it for the style. I'm also the president of drug ambassadors at my school. So the work we do is all about like tobacco with especially the youth and, spreading awareness. We give brochures at lunch. We talk with students, have presentations. In terms of how I feel within the Indian population, I do think that it's something that is more prevalent with youth, especially going to college or parties or whatever. I think regardless of the population or whatever your age may be, I think it's so important to just know what it is you're putting into your body and know that the consequences and how much it can impact your life down the line. I think that there's so many ways to get help if that is something you may need. There's so many resources, even within the Indian population, like doing events like this is so resourceful and so useful for people that may be, in that environment. I always advise hanging out with the right people, putting yourself in good positions and good environments. Personally, I don't like being in an environment where I feel like I'm going to be peer pressured. I know that's easier said than done, but I do think that making sure that you're surrounding yourself with the right people, knowing what it is that you're putting in is the most valuable thing you could do for yourself.
Right. I mean, I think you're well grounded, so you're probably doing the right thing. But unfortunately, not everyone out there sort of seems to, uh, follow those guidelines or those thoughts or suggestions.
Mhm.
So
No, I
I'm not sure as to how we're going to overcome that. And especially, I've seen that the students that come from overseas in college,
yeah.
I mean, like stuff, they used to doing all this in India anyhow, like, so, and some of them continue doing whatever they were used to in India. Even
Mhm.
here, they think that, that's how life is supposed to be like. But, they do end up in trouble for their misdeeds. And I wish these people would learn from whatever you just presented.
Yeah, absolutely. I completely agree. I do think that, unfortunately, like you mentioned, it's really rooted into the culture of being here and, like the ideal, perfect high school, college life, drinking, you mentioned, is a huge thing with parties, going to college. I don't think there is a huge way to counteract that other than spread awareness and really emphasize how important it is. I do think at the end of the day people have to make their own choices. It's just up to them if they make the right ones or the good ones. But I do think that that's something that is happening, especially now with the epidemic, the fentanyl epidemic. It's more and more, in conversation. In terms of the youth, I do think a lot of, young adults have that mindset that, oh, like this is how college should be. And unfortunately, you can't control other people's actions. But I personally believe that if you put your best efforts to at least make an impact, spread awareness, tell people about it, at least they'll keep it in mind, at least in the back of their mind when making those decisions, which I think is the most we can really do right now.
That's nice. Excellent.
Tanvi, do you have any plans to go across the state in the school system to provide this educational information to various student groups?
Yes, absolutely. I love that question. Thank you. I do plan on going to India next summer, actually. I like my biggest thing has always been doing something really big in another country for people that need it and may not be as accessible to these resources. I do think India is one of those countries where overdose is not talked about. I know a lot of my grandparents, my relatives in India, they don't even know what an overdose is, and I think that is so, so important. Um, I do plan on next summer, just after college applications and the craziness of senior year, to be doing something very meaningful, impactful next summer. Actually, this upcoming summer at India or some foreign country and do something like that.
How
So
about here in the US in Central Jersey area in different various counties?
I had been trying to get in contact with a lot of people. It just got crazy when the school year began, but I did get in contact with the Governor's Council of Addiction Center. I've been in a lot of contact, but at the moment, like that is my priority. I do really want to do something larger, reach a bigger audience. I think the summer was a good starting point for me, especially with doing the flag ceremony. A lot of people came and it was really rewarding for me. It was so amazing, one of the highlights of my summer, to say the least. So I will definitely be doing something with other counties, other school districts, other towns in New Jersey for sure.
Wonderful job. Thank you.
Yeah.
Any other questions, anyone, before we end?
I just want to say, Tanvi, you had such a great presentation. The way you presented was wonderful. It was so insightful. And I'm really happy and proud that you're, going out into the community, whether it's, within the United States or international. Like I was so happy that you wanted to even go to India. And if you ever need any support, I'm so down to help you in any way, shape, or form. So please do not hesitate to reach out.
Thank you so much. I really appreciate that.
Yeah.
Thank you everyone for joining this evening. Again, thank you so much, Tanvi, for your time in spreading
Thank
the
you.
awareness about the overdose. And we wish you all the best for your Girl Scout Gold Award Service project. And we wish you the best in your future endeavors. Thank you so much.
Thank you so much.
Good luck,
Would I
Tanvi.
take a picture really quick just for,
Yes.
okay. Okay. Thank you so much. Have a
Thank
good night,
you. Take
everyone.
care.
Thank
Good
you for
night.
having me.
Bye-bye.
Bye.
Bye bye, Tanvi.
Bye.